I first learned about SRT through the medical literature, and then I started researching it myself. I met with the makers of SRT at many medical conventions, and I really knew that the technology was great. I had spoken with many of my dermatology colleagues who had SRT in their office, and they had great outcomes. The problem was that I just didn't know how to implement it in my office.
But until somebody actually sat down and talked with me about the benefits of offering it in our practice, I really wasn't sure if it was something that was right for our practice. I met with SkinCure Oncology several times and went over the details and learned much about it. And once I figured out how smooth the process could be and how awesome it would be to keep the patients in our practice and offer them this non-surgical option that doesn't leave much scarring and has very little risk of side effects, it was a really easy way for us to keep our patients within our practice and not have to refer them out to kind of unknowingly treat them with Mohs surgery or a general surgeon.
I decided to bring it into the office because I was doing so much Mohs surgery, and being in a farming community and an underserved area, I was not able to keep up with all the skin cancers by treating them solely with Mohs surgery. I decided to offer it also because I wanted patients to have another option. So many patients were continuing to grow skin cancers and doing Mohs surgery after Mohs surgery on them. They were getting surgery fatigue. So I felt like giving them another option was something that they were looking for. Plus, I've seen so many patients that are now on 2 or sometimes even 3 blood thinners, and the risk of complications just increases dramatically, whether you have intraoperative bleeding or hematoma postoperatively. I wanted to offer them something that was non-surgical, but would also give them the cure rates that approached Mohs surgery.
I took time, about 4 to 6 weeks, to really do diligence on this technology. And honestly, there was nothing but positive feedback from colleagues using it, from the literature, from patients who had it. So a lot of factors went into the decision, both social, in terms of repositioning the practice without a Mohs surgeon. The need was there. And the technology, which I thought was very, very interesting and high tech, and would be a good fit for how I wanted to retool and refit the practice from a primarily Mohs surgery-oriented practice to a more cutting-edge, newer technology practice with newer applications. So that's how it all came about.
I'm in North Louisiana, and we actually have a very high incidence of skin cancer. My practice, which is multifaceted, has an emphasis on skin cancer detection and prevention, as well as skin cancer treatment. In the 25 years in practice, my approach to treating skin cancers range from surgical excision with what is referred to as slow Mohs, when I used to have pathologist on standby to check my margins. And then over the past few years, have moved into referring to Mohs surgeons. But this past summer, we really were in my practice quite inundated with a high number of new aggressive skin cancers. So I was seeking options for my patients other than having to refer all of them out for surgery. And in my research and reading, I again came across information on superficial radiation therapy.
So I think that for all dermatologists, our bread and butter is really, skin cancers of all sorts. And for really the last decade or so, the treatments for skin cancer have really evolved to include SRT, which has been, nice to see that we have so many different treatment modalities to fit the individual needs of our different patients and their desires. And I think that it's just given us an extra tool in our toolbox to be able to offer incredible care and oversight to make sure that we give our patients the cures that they deserve.